Good day. Welcome to Conversations with AARP in the Virgin Islands. I'm Troy Deshabere Schuster, State Director of AARP in this territory, and it's a pleasure to be with you again this morning. Today, we have with us some guests from the Virgin Islands Department of Health. We have Dr. Magdalia Brathwaite and also Mr. Curtis Callender. Welcome to both of you.
Thank you.
Morning.
Morning. And so we will be talking a little bit about how COVID-19 has affected the psyche of individuals here in the community, because both of you are from the Division of Behavioral Health within the Department of Health. But before that, a little bit about me and what we do at AARP. So at AARP, we are really an advocacy social change organization. We are a lobbying agency from Capitol Hill to every state and municipality in the country. And even right here in the Virgin Islands, we get many bills passed and enacted that have a positive impact upon people of all ages throughout the entire territory. Nationally, we've done stuff like we were a great proponent for the Affordable Care Act, otherwise known as Obamacare. We're always defending Social Security and so forth. Here in the Virgin Islands, we also do a lot of community outreach with various workshops, such as financial planning workshops, entrepreneurial workshops, caring for the caregiver workshops. And so that's what we do. A lot of people think that AARP is an insurance company. No, we're not. We are not an insurance company. They're AARP branded insurance products that are available from various insurance companies on the mainland, but we do not sell insurance. We do advocacy and community outreach, hence this program. And the reason for us having both of you on the show to talk about issues affecting the community and how you are helping with that. So first, starting with Dr. Brathwaite, tell us a little bit of what you do at the Department of Health and the Division of Behavioral Health.
Yes, well, thank you. It's good to be here this morning. And part of my role here is to be the clinical supervisor in the Division of Behavioral Health. And I've provided a variety of supportive services, counseling services for the community, whether they be group or individual work. But currently, my focus is primarily on the Clubhouse, which is a venture where we're providing supportive services for people in the community to have structure to their day, people in the community that have mental health challenges, to have structure to their day, and to have the opportunity to go through a variety of trainings which will help them to negotiate their life circumstances with more confidence. And so those are some of the things that I do in addition to a variety of community programming and speaking engagements to educate the community about mental health challenges.
Excellent. I would love to learn more about your program as we go on through this show, and especially a little more about the Clubhouse. That's very interesting. You and I had a one-on-one conversation sometime previous, and you told me a little more about it, so I look forward to learning more today. And Mr. Callender, tell us what you do at the Department of Health.
Hello again, and thank you for having us. I am the Assistant Director for the Division of Behavioral Health, Alcoholism, and Drug Dependency Services. So my main focus is I function in a managerial capacity, and I have responsibility for various clinical aspects as well as operational aspects of the division. However, since I am based on St. Thomas, the majority of my focus tends to be the St. Thomas, St. John district. So I do a lot of work with our clinic in St. John, as well as the clinic at Barbell Plaza, which they're both outpatient clinics that provide mental health counseling. And then additionally, we also have the Elder Shelter Brant Residential Facility in St. Thomas as well, which falls directly under myself. And then, of course, being that the division does function territory-wide, I also have some responsibilities in assisting our director for the oversight of the St. Croix district.
Excellent. And do you work at all with the different Alcoholics Anonymous groups and the 12-step program here in the Virgin Islands, or do you not? Do you have a different approach?
Well, we have worked with them in the past. Right now it's not something that is going on at a high level. So it is something that we aim to re-implement. The 12-step approach has definitely been found to be effective, for helping people recover from substance use issues. But right now, what we've been doing is providing counseling primarily at our clinic. And of course, with the onset of COVID, we've had to sort of adjust the typical way in which we do things, which has had a great impact on that relationship as well, considering that it essentially is a group-based program, and it's quite difficult to do that right now.
Great. Now, both of you have shared a little bit of what each of you do individually, but I would imagine that the Division of Behavioral Health does more than maybe what each of you do, probably more than the sum of the two parts that we have here, if that makes any
Mhm.
sense. So can you, either one of you, give us an oversight then as to all of the programs, just a high-level oversight of all of the programs offered by that particular division of behavioral health within the department itself?
Absolutely. So the Division of Behavioral Health, Alcoholism, and Drug Dependency Services is essentially charged with providing services to address the behavioral health needs of the population within the Virgin Islands. And so that's, like I mentioned a little bit ago, that's something that is territory wide. So we have services on the three main islands. We have on St. Croix, we have an outpatient clinic at Charles Harwood Complex. And then we also have the clubhouse, which Dr. Brathwaite has referenced. And we have a methadone clinic as well for those that are, working through their recovery from opiate addiction. Then we have on St. John, I referenced the Morris de Castro Clinic, and that's a clinic that offers services besides behavioral health, but we do have a staff member that operates out of that clinic as well, providing counseling services. And then on St. Thomas, we have the Barbell Plaza Behavioral Health Outpatient Clinic. We also have the Elder Shelter Brand Residential Facility, and additionally, we are also charged with patients, with providing care for patients that need residential placement that we don't have within the territory. And so as such, we also have services where we have relationships with residential facilities between Puerto Rico and some of the states, and we send residents there to receive services as well. And then in addition to that, there's also an outreach component in which we provide education regarding particular topics that are relevant to what we do.
Wonderful. And I was glad to hear you mention the methadone program. Uh, Back in the 1970s, early 1970s, my uncle, now retired Dr. Ralph Eschmer, who is an obstetrician gynecologist, he actually started the methadone program here in the Virgin Islands on St. Croix in the
Oh,
early 70s. And it was really much needed then. There was a huge heroin and cocaine culture here in the Virgin Islands at that time. And methadone was a really good solution for helping people get over the addiction. And
mhm.
so I'm glad to hear that it's still in existence and still operating. I hope that people are taking advantage of it, helping to get over their addiction to those narcotics, those opioids. Excellent. And so now here we are in the middle of this pandemic. We're all subject to social isolation, social distancing, they call it, but it's really almost isolation in some respects. I know that I for myself, AARP requires us to work from home. I spend a lot of time in this little room, as I was sharing with Mr. Calendar prior to the start of the show. And even for me, a well-balanced individual, a person who's usually very happy and very optimistic, I know it weighs on my psyche after a while, being here, just seeing people on video conference or hearing them on the phone, but spending pretty much all of my day working alone, and not seeing much of my friends, not going out, not hanging out, and it's really tough for me. So I would imagine that for people who may be bipolar or suffering with clinical depression or other behavioral health issues, I'm sure it must be very, very, very difficult. So, what are you seeing, starting with Dr. Brathwaite? What are you seeing as you talk to people, as you move about the island? How are people dealing with it, and how are you helping people to deal with it?
Well, we're seeing a lot of people that are struggling with reintegrating into the community, obviously, because um, COVID is such a major challenge. One of the things that we've been doing has been reaching out to the people who are uncomfortable with coming in with having some virtual services. Um, just I would say maybe a couple of months ago or during COVID's uh, when COVID really broke on the scene here, we started providing quite a number of online services to help people to address some of the things that they were experiencing. For example, we provided a program called Managing Uncertainty in Uncertain Times, and we've also created a program called the Breathing Clinic to help people to be able to manage some of the challenges that they were and are experiencing. We've done radio programs to provide people with a lot of tips and opportunities to share some of the things that they're experiencing. And we continue to do those things for the community. Not everyone feels comfortable still meeting in person. And so we still try to accommodate that because we are still in an uncertain space. We don't know how long we're going to be here. And so we have to try to find ways to help people to feel a sense of support during this time.
I recall that when we had the onset of the pandemic and all of these lockdowns and people required to stay home, work from home, etc., we heard of a sharp rise in domestic violence. Is that still the case, or has that leveled off? Has it declined? What's your perception of that?
Well, we partnered with the Women's Coalition during this pandemic, and they continue to provide services because it had increased. And so we were trying to bring awareness to the fact that this is an issue and provide options for people to not only share what they're experiencing, but to have some alternative options to utilize, such as our counseling services and or the services that are being provided by the Women's Coalition. Mr. Callender joined me during that time, and it was really important to see a man's face involved in that venture because often we don't get a chance to see that when we're addressing the issue of domestic violence. And so we continue to be an available support for people who may be going through this experience being at home in the pandemic with feeling probably like they don't have as many options.
Yes. At AARP, our research has shown that social isolation has the negative impact of smoking approximately 15 cigarettes per day
Yeah.
on the human body.
Mhm.
And so, sorry, we dropped out for a moment there. I think we're back though. Um, we had smoking, pardon me. Let me start that over because there was a glitch in the internet and everybody disappeared on me for a moment and it threw my train of thought off. But I was saying at AARP, our research shows that social isolation, that loneliness has the negative impact on the entire human body of smoking 15 cigarettes a day. So it not only affects the psyche, the emotions, but also affects the circulatory system. It affects the muscular system. I mean, everything, the entire
Yeah.
body. And during this period of time, we have come to learn that some of our members have developed heightened health problems. You know, their health issues became more severe. And so that's a very major concern for us. And at ARP, we're always fighting social isolation for our senior citizens. And so, what are some of the prevailing signs of of the effects on the psyche, right?
Mhm.
That comes along with this social isolation. What should people be looking out for? And when should they start seeking help? Either Mr. Callender or Dr. Brathwaite.
Mhm.
Well, first off, I would say that I agree with you that this experience of COVID has been, you know, something indescribable. I really don't think that in my lifetime I've seen anything have such a wide-reaching global impact. I mean, there's almost no country you can name that hasn't been affected by this. And so, when you talk about what we're seeing, I think there's definitely increases in anxiety, depression, feelings of loneliness, um, boredom, and then of course you add the financial strain on top of it.
Sure.
People are just overwhelmed.
Mhm.
So when we look at, what are some of the symptoms that you can see in your loved ones or friends, I think you have to, first off, I would say to look for any major changes in their behavior.
Mhm.
Look for what is particularly their activity level, on things
Right.
that they would typically be interested in. Are they now showing reduced or no interest in those things at all anymore? Pay attention to their anxiety levels, general mood, as well as I would also say changes in eating habits. Are they eating way more than usual, or are they now kind of not eating on a regular basis?
Right.
Those are some of the behavioral predictors that I would say that will let you know that something is going on with your friends, families, or loved ones. So just,
Mhm.
as much as possible, be observant. That's the biggest thing I can say. Ask questions about how they're doing and how they're coping, just so that you can get a sense as to if there are any major changes in what their typical baseline may be.
Now, here is probably a bit more complicated question or a complicated issue to deal with. For many of us, we deal we overcome our loneliness by getting on our computer, our cell phone. We are engaging in FaceTime conversations, Zoom
Mhm.
conversations. We're looking at videos on YouTube. We're doing all kinds of stuff. We're text messaging. We're calling. For those of us who are digitally attuned, we have the world in the palm of our hands with our smartphone. But for a lot of older people, people in their 70s, 80s, 90s, who are not digitally attuned or inclined, how do they deal with it? Do you have any ideas, suggestions, Dr. Brathwaite, as to how can people who are advanced in age and who may not have the wherewithal to contact people electronically, how would they deal with it? And Mr. Callender, feel free to jump in as Dr. Brathwaite answers.
So I think that this provides an opportunity for us to become more creative about the way that we connect with people. And I think one of those things could be to develop a routine with someone that is older and is trying to negotiate this. And so that could be calling every day or calling at different times of day or developing perhaps new things too that weren't considered before, such as developing more connections with the community, having people to look out for family members if possible, um, uh, stopping by and getting as close as you can, even if that means that you have to sit in the yard while they sit on the porch and still have some connectivity. Provide random acts of kindness where they may not be expecting that, and a family member could, or church member could stop by. Deepening people within their faith based communities is also an important piece. And having people perhaps begin to try some new things, like maybe you may call someone and instead of having a regular conversation, you decide that you're going to have a book club and maybe read portions to that person, something that you could discuss, or even have the opportunity to have a few people if they are able to have community connection over the phone to sit and talk about some of the things from their past, some of the stories from their past that will keep them connected. Um, it's interesting that we're talking about the loneliness piece of it because I was looking at some statistics from AARP recently, and they were saying that men tend to experience loneliness more palpably But women would describe themselves as actually being lonely. So I think it's really important to know um, if someone isn't necessarily saying that they're lonely or that they're feeling a sense of isolation, doesn't necessarily negate the fact that they are actually experiencing that. And so, stepping in, churches in particular could develop maybe a list of calling where they can do some wellness calls for people, just to check and see, because that is true. A lot of the older people may not have the world in the palm of their hands, may not feel as comfortable in doing that. So it just requires the people around them to provide some more creative um, options that may feel more comfortable for people that are older. And like I said, that may be utilizing the telephone.
Yeah, yeah. I've tried to do some creative things for my mother, who's 87 years old now. And for instance,
Uh-huh.
when she celebrated her birthday in May, her 87th birthday, I had a virtual birthday party for her. So I set up a very large computer monitor and hooked up my laptop computer to it and everything, and had a speaker connected, and had a friend create a nice backdrop for her with all the balloons and all the sparklies and so forth, and had her sit in front of the background, and had all of her family and friends, more than 100 people from all over the country, join on Zoom, and all of them, I brought them up one by one on the screen so she could see them individually, and they wished her happy birthday, and she just loved it. That was her first experience of a video conference, believe it or not.
There you
And
go.
yeah, and for days she was so happy with that. And so now Thanksgiving and Christmas are upon us, right? And so now I'm trying to figure that
Mhm.
out. Do we have a whole meal on Zoom rather than just saying happy birthday and slicing cake? But so she started saying, "Oh, I want to have Aunt so and so over and Uncle so and so over." And she started planning, and I'm sitting there thinking, "Okay, let's see how this goes now, right? Because I know that we're not going to have all those people over." But I didn't want to just come right out and say no. So I allowed her to plan and plan and plan. And then finally, I led her into talking herself out of it. But Mr. Callan, do you have any tips for how we can get what we can do, or suggest to people for how they would celebrate Thanksgiving or Christmas? I don't know. Maybe you do, maybe you don't. This is maybe a trick question for you. But how do we get through the holiday season with a pandemic still going on?
Well, I mean, like you said, it is definitely difficult. Um, I don't think that it's a bad idea to have a virtual Thanksgiving, but it's just not the same, no matter how much you try. So, besides that, what I would say is that it is possible to have potentially a small gathering, but if you're going to do that, you have to be aware of what the risks are, and you have to do your best to mitigate whatever those risks may be. So, first and foremost, I would say that if you're going to have people over, it would need to be, just a few people. And then in addition to that, you would want to make sure, of course, that, I would recommend that everyone is tested prior to coming together, so that you have a sense as to what their actual COVID status is, and then of course follow all of the other guidances that have been put out by the CDC and the Department of Health. So making sure that they are wearing masks that cover both their mouth and their nose, making sure that everyone is washing their hands routinely. Perhaps even spacing the seats far apart, so that if you're able to, so that no one is too close to each other. And then I would also recommend using single serving items, like dressing and stuff like that, a single packet, so that everyone isn't touching the same thing. And also, perhaps people bringing their own silverware and stuff along those lines. So that is the answer if you were to still attempt to engage in a small gathering. But of course, there is a risk involved in that, and so you need to be aware of that. And the preference would be that you keep it to only people within your household. And if you want to include people that are extended family, that then you do so via a Zoom or some other virtual means.
Excellent, excellent. So some good tips there, as you said, getting tested before attending a family gathering. And now they have rapid tests here in St. Croix. I know that there are several physicians who offer the rapid test. Wearing masks when you go to visit your family, your friends, making sure you wash your hands frequently. You also mentioned bringing your own eating utensils, your own silverware, flatware, as the case may be, and also practicing social distancing, etc. So some really good tips that we need to keep in the front of our minds as we engage in the celebrations of this holiday season, which are right upon us now with Thanksgiving around the corner. So thank you for those ideas. And so, Dr.
Can I
Brathwaite,
just can
yes,
I just add to I think I was kicked out for a moment
yeah,
and just got back on. But I also want to suggest that um, if there are seniors that do have family members that reside with them and they are trying to introduce new things to them, there's so many things that have been opened up in the world now. There are museums that are allowing people to come in and to do virtual tours of their exhibits and museums. There are audio books that people can be exposed to, and maybe they can try something new. Um, there are a lot of seniors and a lot of individuals that are engaging in things like earthing, where they're just going out and sitting in their yards with their shoes off in the connecting with the earth, just to get a sense of groundedness. Because sometimes when you are going through challenging situations, sometimes doing things that are very simple can be very profound and could also create new opportunities for topics of discussion. And then obviously, if people are don't have a pet, getting a pet now might be a great idea, just to have another life in the house with you if you're alone. So there are some things that people can include in their activities of daily living that are different during this time that could be so useful.
as they say, necessity is the mother of invention. So,
Yes.
just us being creative during these, being creative, inventing new ways of socializing. And so now we have less than a minute left. So if you just tell us briefly, how can people find out more information about the services offered at the behavioral health unit?
Well, to find more information, you can contact the St. Croix office at area code 340-718-1311, extension 3631, or you could contact the St. Thomas office at 340-774-7700, extensions 2114 or 2102.
Excellent. And Dr. Brathwaite and Mr. Callender, I thank both of you so much for being on the show with us today. We had a few rough moments here, but we made it through. People in the Virgin Islands understand our challenges. So again, thank you both for being with us, and we look forward to having you in a future show.
Thank you.
Thank you so much.
Thank you.